Well, I know for sure someone who's going to have an opinion about this, and that is the first member of our morning roundtable. Each Saturday morning, we have 3 experts out in the field, literally offering their expert analysis in everything from health to faith to now relationships. And first up on our morning roundtable is Dr. Dana Ewells. Dr. Dana, good morning.
Good morning, Mike and Gina, and to Colleen as well. You were trying your worst way to get me off of my topic for this morning.
No.
Hey, give us your 10 seconds on that.
I would have to give you 10 minutes.
Oh, no.
With that said, this is a very good topic for us to talk about in future, because I do have some strong input concerning the things that you've talked about, both the sauce on the tongue as well as the spanking issue.
Well, Gina, being Italian, Gina prefers marinara sauce instead of the hot sauce.
But with that said, on 2 personal issues, I just want to say go Packers, because of my only tie is Charles Woodson, because I know he has been involved in the past with work with Mott's Children's Hospital in Ann Arbor. Yes. And leading into that is I just wanted to say on a personal note that I want to continue to wish Colleen Shoemaker the best with her Hearts of Hope work, and we continue to pray for that work, because it's such a great help to a number of families.
Absolutely.
Thank you.
That leads me to my topic for today, which is acetaminophen, better known as Tylenol, but also sold over the counter at various pharmacy outlets under their own brand names. Felt we should talk about its safety and usage because of the fact it's been in the internet and the news media so much during this past month. It's the most used pain reliever that we have in the United States. It's taken by over 60 million Americans each week. It is the most common agent that is reported in our poisoning stats, and is the leading cause of acute liver failure in the United States as well. Liver being the organ where it is broken down.
Did you say it's Did you say it's the leading cause or a leading cause?
No, it's the leading cause of acute liver failure in the U.S.
No kidding.
Yes, and as you can see, by the 60 million Americans that take it each week, that is probably the prime reason.
That's startling.
It accounts for, these are some interesting statistics as well, it accounts for 13,000 ER visits per year, 2,000 hospitalizations, 1,000 to 2,000 cases of acute liver failure, and 100 to 400 deaths annually.
Just by taking too much acetaminophen?
Just by taking too much under the wrong circumstances. In most studies, it's felt that the reason for these large problems with acetaminophen result from it being so readily available, its overuse, and the lack of public awareness about its potential side effects.
Well, Dana, I find myself when I walk into the store, I grab a thing of Tylenol, and I realize that's actually got 500 milligrams in it. And I take 2 usually, but not with 500 milligrams, I wouldn't.
And my recommendation now is that if you look at, again, the most recent studies, is they are at work to try to decrease the total dosing milligrams to 375 back to where it was before. So it's so very important for us to remember that this drug has 2 primary uses. It's to treat temperature and to treat pain. It's not to give when our kids have just a runny nose or sniffles. It does not do a thing for that. It's also important for us to remember that the combination drugs containing acetaminophen should not be used at all, especially in children, due to the increased potential for overdosage and resulting liver toxicity. There's 3 dangers of acetaminophen use, and those dangers include overdosage, or giving more than the recommended dose, overuse, where you're giving more frequently than recommended, or, more importantly, in many cases, giving when it is not even indicated. And then, of course, individual sensitivity, where we can all be sensitive to any drug, but in this case, Tylenol or acetaminophen.
And we've been talking about
studies.
Dana. We've been talking about. It sounds like there's a lot of danger with children, but this applies to adults as well.
This applies to adults as well, and that those stats that I gave early on included across the board from children up to adults. Yeah. Now, the symptoms that I want our listeners to be aware of is with acute liver failure, secondary to acetaminophen, include 4 phases. Phase 1 during the first 24 hours, and it's so important to get to these people who are having acute liver failure. The phase 1 in the first 24 hours includes decreased appetite, nausea, vomiting, listlessness. Phase 2 during the second 18 to 72 hours includes, now we get in the right quadrant abdominal pain where the liver is located, with, again, decreased appetite and vomiting. And then finally, phase 3 in 72 to 96 hours, where you get the severe abdominal pain, the jaundice, the coma, the vomiting, the renal failure, and potentially death. And then phase 4 is those people who just spontaneously, completely resolve during the 4 days to 3 weeks after the ingestion. Now, this is very important. This is what I want the listeners to hear today. You should discuss with your physician, whether it's your own personal adult physician or your pediatrician, the following 4 points about acetaminophen, and ask for some type of written handout. We always had a written handout where there was no doubt as to what dose the child should take. But ask why give it. And the answer should be in the temperature or pain area. When to give it, at what levels of temperature or pain, and how much to give. It's dosed by weight only, not by age, and that's a very important point to remember. And then how often to give it during the course of the 24 hours. Remember, do not use it when it's not needed or indicated. It's a safe drug. It's very important medication when used properly by itself and properly dosed, but has that potential to be to cause a problem when it is improperly dosed and given at wrong intervals and so forth. So I know it sounds like a minor issue, but it's a medication that's so widely used, as 60 million Americans per week use it, that I just felt your listeners should be aware of that.
And since it is something that alleviates pain and discomfort, I also know, and I think this is true. I say I know it, but I'm looking for confirmation. Alcohol actually can add to the dangers.
Absolutely. Definitely alcohol and medications in general do not mix, but in this case we're talking about acetaminophen, so you definitely do not want to mix the alcohol with the acetaminophen dosing. So that's a very good point, Mike.
It's like a staple in the cabinet that can do great harm if used incorrectly.
Absolutely. A very good drug for us. It does the right things for us for pain alone or for the temperature alone, but that's the only reasons that we should be using it, and definitely not in combination drugs where it has more than one element in the drug itself.
Well, Dr. Dana, absolutely perfect. Thanks so much, as always. Every Saturday you bring something, just what we need, and when we need it.
Have a great day and a great week.
Thanks so much. Bye now.
Take care.